Hello, Virginia Conference. I know that many of you have heard and have seen on television, as well as heard on the radio, as well as read in Facebook that we are now faced with the increase of the Delta variant and then the documented Lambda variant that was first documented in Houston, Texas. My note to you all today is to be influencers. Influence folks in your home, community, church, co-workers to go and receive the COVID-19 vaccination. Later in this video, we will have medical professionals that will share with you the importance of being vaccinated. I pray that you will have a wonderful and safe summer. And as your bishop, I've always desired for you to be safe as well as informed. Thank you.
The Delta variant continues to be a concern all across the country.
With COVID on the rise again and the CDC asking unvaccinated people to get the vaccine, we brought together medical professionals to answer some of the internet's most asked COVID questions.
We're seeing a rise in cases. COVID never really went away. We have seen some times when we didn't have as many cases, but unfortunately we are seeing a rise in the number of cases now.
I don't think COVID ever went away. We have had low rates of infection through the summer, but now we're starting to see it surge up again. And so as we look forward, we imagine that COVID will be with us. It's going to be an endemic infection that we're going to have to learn to live with.
Absolutely. The COVID-19 vaccine is incredibly safe. It's been rigorously tested, and I've recommended it to every member of my family, and they've all gotten it.
We have never had a vaccine that has had this much scrutiny. 350 million doses have been administered here in the United States, over a year and a half of clinical trials at this point, and the technology that this vaccine was built on was 20 years in the making. And so what we are seeing is a vaccine that has been incredibly effective and incredibly safe, especially in the face of the toll that COVID has taken on our community.
The COVID virus is, like other viruses, able to mutate over time. In other words, it's able to change. And the Delta variant is the most recent variant that we're seeing here in the United States. It is twice as contagious as the original variant that we were seeing, the Alpha variant. And unfortunately is also more likely to make people much sicker if they contract it.
Vaccine provides great protection from the Delta variant. And while we have seen a few people who've gotten breakthrough infections or infections after being vaccinated, those people still have protection from hospitalization, from intensive care stay, from mechanical ventilation, and from death.
The vaccine protects you against severe illness. So it protects you against hospitalization and death from the COVID virus. It is still possible, though, to get the virus itself, albeit with a much milder case. So even vaccinated people can unfortunately still get the Delta variant of the virus.
So no microchips injected by the government. We don't expect anybody to become magnetic, and I wish I could offer superpowers other than being a hero to your friends and family for keeping them safe. We don't know of any. The most common side effects that people see are a sore arm. Some people may get body aches or fatigue, tiredness, and some people may get a fever or other flu-like symptoms, but those are usually short-lived and resolve quickly.
There have been any number of things circulating on social media and on the internet about what the vaccine can do to you. Does it make you magnetic? Is it a microchip? Will people be able to track you? And the answer is absolutely no. At every turn, these myths have been debunked. The safety of the vaccine, especially in the face of a much more contagious strain of COVID, has just been overwhelmingly positive. And so I think this is a real issue that people need to grapple with. There's so much wrong information out there that people need to go to credible sources. They need to talk to their healthcare providers. They need to talk to people and look at data that's grounded in reality to be able to make that decision for themselves. I understand that the timeline of this vaccination is a huge concern for a lot of people. I will say what feels very different about the development of this vaccine. One, there's never been a time in our history where so many people were working together, so many financial resources were put into the development of a vaccine. This was a global effort, and it's really remarkable that a vaccine was able to be developed on this timeline. But the other important thing to remember is that it wasn't just a vaccine that was created in a year, that this vaccine was built on technology that's been in evolution over the last 20 years. We've used these types of platforms with varying degrees of success with a lot of different diseases. And so we had a shell to build off of, and we should be thankful that it has been as effective as it has been.
I think that's quite likely. I think over time, as we understand better about the virus itself and about how long the immunity lasts, both for people who have immunity as a result of the illness, as well as people who have immunity as a result of the vaccine, that we're likely to need to booster like we do with the flu vaccine.
It seems very apparent that we're going to need COVID booster shots for at least a subset of the population, if not everybody. And I would encourage you to absolutely get your booster shot when you're eligible.